Dr. Levy, for those of you who don't know, is a professor, because she's just nationwide and worldwide now, renowned at this point in time, I feel at least. Dr. Levy is a professor of shelter medicine at the University of Florida. Her research and clinical interests center on the health and welfare of animals in shelters, feline infectious diseases, and humane alternatives for cat population control. She's the founder of Operation Catnip, a nonprofit university-based community cat trap-neuter-return program that has spayed, neutered, and vaccinated more than 55,000 cats in Gainesville, Florida since 1998. In 2008, Dr. Levy joined Dr. Cynda Crawford to found Maddie's shelter medicine program at the College of Veterinary Medicine, an educational and discovery initiative with a global impact on the care of homeless animals. In 2014, she joined Dr. Kate Hurley to launch the Million Cat Challenge, a shelter-based campaign to save 1 million cats in shelters across North America. For the past 2 years, Dr. Levy has worked with animal shelters to better understand, diagnose, management, and outcomes in feline leukemia shelter cats. Welcome, Dr. Levy.
Thank you, and for inviting me, and I'm really looking forward to all of the sessions. I'm going to be giving a quick overview of some of the key highlights of the new guidelines that have been released by the American Association of Feline Practitioners. But please know that there is a lot of backup material and other details that are contained in this document. I've provided the document to Stacy so she can share it out. It's also available online, but it is 26 pages of fine print, starting with everything from the basic virology to vaccination and treatment. And those are topics that I'm not going to be talking about today. We'll be focusing on 5 key breakthroughs and emerging trends, including some work that's not even published yet from our research with Austin Pets Alive. So think of this as the lightning round of highlights to help you start or advance your FeLV program. These are the topics I'll be touching on today: our routine testing protocols, a new FeLV staging plan, and this is a direct outcome of our work on diagnostic testing in cats with FeLV, evidence that FeLV cats can safely mingle with cats that are not FeLV infected, which can impact how we select cats and homes for adoption. A major paradigm shift in mass screening, especially in shelters, and a plea that adoption is the best outcome for cats with FeLV. So including better than euthanasia, better than a long stay in the shelter, and better than going to a sanctuary. But first, we're going to catch everybody up to the same playing field with a brief recap of the feline retroviruses, FeLV and FIV, because we frequently think of them together, and we also test for them together, usually in these combo tests, but they are quite different. FeLV and FIV are both retroviruses. FeLV is primarily spread by close contact and body fluids, such as from kittens to their infected queens. So probably grooming and milk is the most effective way to transmit FeLV, and that's probably how most cats become infected. It's kittens from their mothers, but they can share it among housemates. So sometimes you will hear that adult cats are very difficult to infect with FeLV, and that is not entirely true. Based on new information, we definitely can see that adult cats that tested negative as kittens are found later to be positive. And then fighting. Fighting is something that's not mentioned frequently enough as a risk factor for FeLV because we think about it with FIV, but it does occur. Cats with abscesses from fight wounds are much more likely to have FeLV. If we contrast that way that the virus is spread, in FIV, it's almost exclusively by fighting. It's a dramatically different risk than FeLV. And that's why we see FIV mostly among adult males. If you're looking at a group of cats at your TNR program and there's a big tomcat with big cheeks and a lot of scars, there's a decent chance that he's going to have FIV, where the risk will be lower in the other cats that you trap. It's very unlikely to spread within homes if the cats don't fight, or in shelters, because again, the cats are generally not fighting or they're housed individually. Once cats are neutered, their aggression decreases dramatically, and so we're not going to see as much transmission of FIV among neutered cats. In fact, neutering is a great way to reduce the spread of both viruses. This is why we actually don't recommend testing in our TNR groups, because simply spaying and neutering reduces the two major ways that the virus is spread. We don't have infected kittens that are born to spayed and neutered queens, and we don't have fighting anymore among the adults for FIV. So if we can put all of our resources into expanding TNR groups and spay neuter, we will go a long way in reducing the spread of these viruses as well. Now, the outcomes for FIV are very straightforward. This is a lifelong infection. Cats never get rid of the infection. It's similar to a related virus, HIV, in humans, where the virus can become asymptomatic for a long time with medication with HIV or just naturally with FIV, but the virus never goes away. And yet, FIV infected cats can live normal lifespans and have a very, very long asymptomatic period. In fact, they may never get sick. But some cats we know will develop diseases associated with FIV, such as stomatitis being the most common one, or we can see some odd infectious diseases that take longer to cure than we would see in cats that are free of these viruses. Now, FELV continues to become more and more complex the more that we study it. We did a big study in Austin of 130 FELV infected cats from their adoption program. And we tested those cats monthly with a whole panel of different tests. And we were hoping to be able to come here today and tell you what the very best test was that could predict whether a cat was infected or not. And I'll talk about the results of this study in some detail today, but I'll give you the preview is that we did not find that answer we were seeking. All we found was more complexity. So if you can sit back today and sort of absorb the information, but let go of the idea that we're going to solve this all for you, you might not be as frustrated. There are two forms that are most common with FELV. One is the progressive form, and this is what we classically think of with FELV. These cats stay testing positive all of their lives. They are at increased risk of developing disease and having a shortened lifespan. They are contagious to other cats because they are spreading FELV in their saliva. And most of these cats will test positive most of the time, regardless of the tests that we're using. The regressive form occurs when the cat's immune system suppresses that virus but doesn't completely eliminate it. So sometimes we can't even detect the virus. It's suppressed below the detection level of the test. So if we are randomly testing cats one time in their life, we could easily test these cats on a day when that virus is so far suppressed we're not going to detect it. So we also have to let go of the fact that a single test in a single point of time is going to tell us the true infectious status of that cat. The good news is when this virus is well controlled, it doesn't cause as much disease in the cat. Some of these cats may have a normal lifespan or certainly live longer than cats with progressive disease. It's not contagious at the time it's regressive. They just don't shed enough virus in their saliva. And these cats may test negative from time to time. Now, the challenge is they can waffle back and forth and live on the edge between progressive and regressive infection. So just because a cat is suppressing its virus and is not contagious one day does not mean that it's going to be the same on another day. So stressful events especially can bring this virus back out if the immune system is stressed. This is really what we're going to talk about the most today, is this progressive and regressive scale that cats are walking all of the time when they're infected. There is another stage that is much less common, or at least we don't recognize it as commonly. That's called abortive. That is cats that become infected, but they completely eliminate the FELV virus. And the issue with that is we're usually not going to know about those cats because they're only positive for a short time in their life. And the chances that we're going to test the cat during that little window are low. So this is a life cycle of FELV infection and how it's transmitted among cats. It's a typical cycle like we think about with infectious disease. So starting at the top, we see that red, aggressive, infected cat picks a fight with the negative cat and transmits the virus via a deep wound from its infected saliva. And then it goes through an acute phase in the green cat, which we generally are not going to see. People generally are not going to bring their cats in during this phase because it's quite mild. But if we know a cat has been exposed, we can see a transient fever or anorexia or big lymph nodes. But that only lasts a couple months. And then the cats enter an asymptomatic phase. This asymptomatic phase can be very prolonged, years and years, and perhaps the rest of the cat's life. There will be high levels of virus shedding in the saliva, so these cats are infectious, but they are healthy. Generally, they're going to have a positive FIV antibody test at that time, and the PCR test will usually be positive unless it has a strain that the PCR test does not pick up. That is becoming less and less of a problem over time. Our PCR tests for FIV are pretty good at these days. And then the final clinical stage, this is like an AIDS stage, end stage level of infection, is when we start seeing cats that are developing disease associated with the virus. There's a dashed line there because many cats do not progress to the clinical stage. In this case, you're going to see the cat again have FIV antibodies on our combo tests, and very likely to be testing PCR positive. But so much more complex is the life stages and transmission of FeLV. It's not a pure cycle that we can predict cats will go through. So we start with our cat that has become infected with FeLV on the left. If it has a strong immune response, it is going to suppress that virus. We're going to have very low levels of virus that we can detect on the PCR test, that's the provirus, or on our combo tests, and that's the antigen. So those levels, even though they're still in the cat, may be present in the blood that is circulating that we can sample at such low levels, it's not going to be detected on either test. However, if there's a weaker immune response, the cat is going to progress towards that red stage, which is the progressive stage. In these cases, the cats have high levels of virus in circulation, pretty easy to diagnose because they have lots of provirus for the PCR and lots of antigen for our combination tests. So that's all pretty straightforward until we understand that these cats can move between these two categories and likely do with some frequency. So if the immune system stays strong, the virus will continue to be suppressed, the cat will have a healthy life and live a long time, and likely not be shedding the virus to other cats. However, if stress occurs, such as a pregnancy or another illness or just unhappiness, if another cat is added to the household that they don't like, or if they're confined indoors and they find that frustrating. So those cats are the ones that are going to have high levels of virus that's not controlled and more likely to develop clinical disease and early death. So this is a real key point to focus on for the rest of our talk this morning, is cats are not fixed in one place. We have to understand when we give cats a test at one point in their life, it is a snapshot for that day. All right, so after layering a foundation of confusion, I'm going to start moving into our 5 key takeaways, starting with routine testing protocols. So this is where I have ended up after doing all of this research and following these cats from Awesome Pets Alive for almost 4 years now. This, I think, is the most practical compromise between being effective and practical in shelters and getting testing that's as accurate as possible. So there's what I think most shelters can do, because it's not really possible to do elaborate testing and to hold cats back for months and months trying to figure out what their status is. Once they have a positive test, especially for FeLV, it's very hard to ever convince yourself that that cat is not infected. So rather than running tons of confirmatory tests, I would just accept that value of the first test unless it just doesn't make sense, and go on and manage the cat as if that first test is the right one. Especially now that we're recommending adoption of these cats, the bad outcome for being wrong on that first test isn't as severe. So You all know that the tests come generally as a combination test, point of care that you can run right there in the shelter or the clinic. So you can take a little bit of blood, run it on the test, and in 10 minutes, you're going to have an answer. So I recommend that we start with that test and we get a result that's positive or negative for each virus. And that's called one and done. If you stop there, you move on and start working on placing the cap. One thing I would say is that if you have cats that you are planning to use for blood donations, those cats really should have a good PCR test before they're used for blood donations, because even if they test negative, if they're regressively infected cats and you can't detect that virus with your point of care screening test, they can transmit that virus to another cat. And presumably if a cat is getting a blood transfusion, it is sick and stressed. So that virus can come out full blown and make them sick and further compromise their recovery. So I know sometimes when we're giving blood donations in the shelter, it's kind of an emergency and we just grab the healthy cat that we can find and we don't have time to screen for blood donors. But if you happen to have some that you keep around for that purpose, or if you use your own cats as blood donors, those definitely should be screened by PCR as well. So if you want to do more confirmation or learn more information about your first screening test, it's become fairly simple now that the best confirmation test is a PCR test in a reliable lab. You really can let go of IFAs and Western blots, that the new PCR tests are so good and give us as much information as those other tests do, that it really is easier to work with one lab that can provide you good information about the PCR test that is done. So that does simplify some of the confirmatory tests. However, still remember that if a cat is positive on that first point of care screening and negative on these other results, it doesn't mean the cat is negative. There is a misunderstanding I've seen frequently where people always assume that that second test is the right one. Or they keep running tests until they get a negative and then they decide that's the correct test, because we really want these cats in our hearts to be uninfected. But when a cat is discordant, it really is not possible in general to know the true status of the cat, or at least to ever prove that the cat is uninfected. Fortunately, that's not very frequent, but we also need to let go of the idea that we can have certainty. I did want to take a moment to talk about the selection of the tests. There are different brands that are available and they have different levels of performance. And I would say that this is an area in test selection that you should not compromise on. It's already hard enough to interpret test results, but if you pick a test that is not as accurate, it's going to really complicate interpretation and lead you down the wrong path. I think that if you are not able to select a test with high quality and high reliability, it would be better not to test at all than to use that inaccurate test. So we were very curious now that there's many tests that are on the market about how they all line up, because they're always being refined and improved over time. Also, tests are acquired by one company or another, and they may change their manufacturing process over time. So it's important to do good studies from time to time that compare them head on. So we took a collection of samples for FeLV and FIV that were of known status through virus culture and other means. So it was a very high quality sample set of over 300 samples of each, from FeLV and FIV, and some cats that were known to be negative that were actually a really high quality sample. They were laboratory cats that had never been exposed to virus. So we knew for sure that they were negative samples. And we took the samples and ran them at the same time in all 4 of these different tests. Now the IDEXX SNAP, Zoetis Witness, and Abaxis VetScan are all available in the United States, and the BioNote antigen is available in Europe and other countries. Abaxis has recently been acquired by Zoetis as well, so they're currently selling both tests. So what did we find? We found that the best performance overall for both FeLV and FIV was the IDEXX SNAP test. The next best test was Zoetis Witness, and this test often is quite a bit cheaper than the SNAP test. So if you cannot afford the SNAP test, this is a reasonable second option. The BioNote was also very good. I don't have a star by it because it's not available in the US, but it would be equivalent to the Zoetis Witness. The one test that did not fare well was the Abaxis VetScan, and I would not recommend this. And this may have a Zoetis label on it now since it's been acquired by Zoetis. And this is a commonly used test because it's a simple product to use and it's available very inexpensively, which is appealing to animal shelters. So next time you're in your shelter, go look in the drawer and see what tests you have. And if you have Abaxis tests in general, I would probably look for a different brand. Just as a side note, we've seen a lot of problem with the Abaxis parvo tests as well. And we have seen shelters calling us because they think they have a parvo outbreak or at least an infected puppy. And it turns out to be a false positive and also often has led to quite a bit of drama in a shelter that thinks they have an outbreak when they actually did not. And then we also want to ask, what is the best test sample to use? And I'm going to say something that is probably contrary to what a lot of you have heard, but we have shown that whole blood is the best sample to use for FeLV. It is the most sensitive. And in the past, some folks had thought that meant it was a false positive because they got a positive on whole blood and a negative on plasma or serum. But based on all the extensive PCR testing and other testing that we've done, we do recognize now that at least on the IDEXX SNAP test, if you get a positive or a weak positive on whole blood, it is most likely an accurate test. However, it might be flagging those cats that have regressive infection. And if you spin it down and run it again on serum, you might get a negative. And it doesn't mean the cat is uninfected. It means that that cat has a very low level of virus and it's probably a regressive infection. So there's also some pitfalls in testing that shelters should avoid. These are things that I see being practiced. One is select that good test. Use the test the way it was intended. I see all kinds of crazy shortcuts that people do, or they misunderstand how to actually run the test. The things that people can do sometimes that I've seen is they snap that SNAP test before the sample has run all the way across that window, which means that your sample never got to the test spot. And so you probably got a lot of negatives because you didn't allow the test to work properly. Or you walk away and leave it for more than 10 minutes because it's easy to do and hard to wait for 10 minutes when you're busy. So you have to read the tests at the time that they are scheduled to be read because false positives on any of the brands can emerge if they're allowed to run too long. There's also a false assumption that all of the cats in a group would have the same status. So I see this where sometimes people will say, well, I'm going to test 3 cats in this colony of cats to see if they have FeLV or FIV. It's totally inappropriate because most of the cats will be negative and you can't test a subset and know the status of the other cats. The same occurs in litters of kittens. If a mother cat is positive, she may have a mixed litter of kittens that are positive or negative. And vice versa, we have seen positive kittens from mothers that are negative. And we don't have a clear understanding why that would happen. It's possible that out in the community, they were nursed by another cat, which can definitely happen. Cats will nurse each other's litters. Maybe that other cat that we don't know about was infected, or maybe that mother cat had regressive infection and we can't detect the virus on her, but she is spreading it to her kittens. So we should test one cat with one test and not mix samples or test just certain cats in a litter. It's really better not to test at all than to test inappropriately. And then make sure the record is very clearly indicating whether a cat was tested or not. So now we'll move on to the newest information that I think is the most exciting, which is FeLV staging. Staging refers to identifying the clinical stage of the cat. This is the disease status, not the infection status, but what it is doing to the cat. And based on this big study we did at Austin Pets Alive, where we identified 130 cats when at the beginning, when they came into their FeLV adoption program from around the country, we tested those cats every month for 6 months with a panel of tests, including SNAP tests, PCR, and IFA, and even sent samples off to research labs in Scotland to do advanced testing. So we have very clear idea of how these cats' status emerged or fluxed throughout this time. And now these cats are also enrolled in a follow-up study in which we are going to follow them for their lifetime to see how long they live. So we will be able to connect the results of that detailed testing, not only to tell you what the best and most reliable tests are, but also whether they can predict outcome and survival. So you are going to have availability of this as a recorded slide. Also, I provided a PDF copy of these slides as a handout, so you don't have to write any of this down. You get a copy of all of these slides, because I really want you to be able to hear as I describe this and not worry about copying rapidly. So what we have learned, starting with our 130 cats that were positive on a point of care screening test, and that was whole blood in an IDEXX SNAP test. We had our 130 cats that were positive. And then we had a few that could go up into the abortive category. These were ones that at intake they screened positive, but by the time we started them in the formal 6-month follow-up study, they were negative on all of their tests. So they actually, as far as we could tell, rejected the virus completely. So they are going to be antigen negative, PCR negative, and live a normal lifespan. Then we have our regressive cats, and the regressive cats could have a combination of different test results, and these can change over time. They could be antigen negative and have a very low level of PCR positivity, or they could be antigen positive and negative on the PCR, or antigen positive and very low level of PCR. It's all about this amount of antigen or PCR positivity that puts them in the regressive category. And these cats more or less live a normal lifespan, as far as we can tell. And then the progressive cats are the ones that are positive on all of the tests. They have high levels of virus on the PCR. And we can predict that as a group, they have a lower lifespan, but we also know there are exceptions that retest repeatedly as progressive infection, but they just keep living and seem perfectly healthy. So this is the new data. We haven't published it yet, but it's really exciting. We've been following these 130 cats for almost 4 years now prospectively, and we're hoping to follow them the rest of their lives. And this is a survival curve. So we start with all of the cats in the upper left corner. They're alive, 130 cats when we start. And then there's weeks. It's a timeline over the bottom. And what we see is the proportion of cats that are still alive at each timeline. So we ended up with 10 uninfected aborted cats. They are all still alive. 35 cats that we identified have regressive infections with low levels of virus, and 80% of those cats are still alive. And then if we look at 85 cats that have progressive infection, those cats just had a progressive decrease in survival. So if we look at the 50% rate here, between the 0.4 and the 0.6, you see these cats lived a little over a year, somewhere between 1 and 2 years. So if we identify a cat as having progressive infection, we can say that as a group, their chances of survival are lower. But we're almost 4 years out, and we still have about 20–25% of those cats that are alive. So this is useful information when you're doing your very first identification of infected cats. If you turn in that panel to IDEXX, that is a combination of a lab antigen test and a quantitative PCR test, they will tell you how much virus that cat has. So I'm going to show you some examples from our study now. This is Jasper. He was a 4-year-old adult cat when he came into our program. We have no idea how long he'd been infected. Like most cats that come into shelters, they don't come in with a history. So what we see here is all the months that we have tested this cat. We tested them monthly for 6 months, and then we had a couple spot checks over the next couple years. We'll see that with whole blood on the SNAP test, he was positive early on, and he was positive on plasma, but then also positive on serum, but not plasma, those time points. The PET check is the laboratory test. He was, positive on that a couple times, but negative on serum. So you can see how the whole blood is the most sensitive sample. Plasma is the second most sensitive sample, and serum is the least. And this is all related to how many blood cells are in the sample. The virus can stick to the outside of white cells and red cells. So when there's blood cells in the sample, you're going to detect more of the virus. And then if we keep going, we see that his PCR is always positive, and we quantified the result, and it was always a low positive for PCR, so not very much virus. We also did the IFA, and on the very first sample, the lab told us it was indeterminate. It was sort of this like weak positive, but they didn't want to call it a positive. And so we staged him at each test point as regressive. This cat has been solidly regressive, but what you'll notice is on those SNAP tests, depending on the day and the sample that you tested him, you would get a different result. He is on that knife edge, wobbling between progressive and regressive infection. So this is good evidence that we need to be cautious about how we interpret a single FeLV test. It is simply a point in time. Contrast that with Basil, who is a progressive cat, and every sample and every test that we run on him is always positive. So he's a cat that follows the rules. He's got this virus, it's at high levels, and we call him progressive at each time point, but he's still alive at 3 years, and so he is defying his group prognosis of most of the cats dying between 1 and 2 years after diagnosis. And then Crayola is one that just won't follow the rules for us. So at different time points, we would diagnose Crayola with different stages. So you'll see if we just randomly tested a cat at intake, like we did for this cat, on the first test, he was negative on all of our screening tests that we would do in the shelter, but positive on PCR at a low level and negative on the IFA. The next month, he's positive on all of our tests, except weak on the IFA. And then the rest of the months, he wobbles back and forth. If we tested this cat with all of these tests at month 5 and month 6, we would think he was negative. Or if we knew he had a previous positive test, we would diagnose him as abortive, that he had recovered from infection. But no, he didn't. Look at those tests at 1 year and 2 years later, 2 years and 3 years. He's positive again. This virus was hiding inside of this cat. And this is really a reflection of the fact that we're only testing blood, what's in the circulation, and not all of the other tissues of the cat that we can't do unless we're doing an autopsy. So this is more reason to kind of let go of the amount of control we think we have over the status of a cat. Going to move on now because that was probably pretty traumatic and frustrating section of this talk, disturbing maybe, or maybe freeing and liberating, depends on your point of view. And we're going to talk about what to do with the cats. So I think most people now who are doing rescue and sheltering are aware that the evidence shows that if cats are healthy and they don't fight, that you can mix FIV positive cats and negative cats, and that chances are not zero, but they are very low that they will transmit the virus. So this is really allowing us to adopt FIV cats into homes with negative cats. This was a study that's been published from 2014, where they followed cats in a sanctuary over time, and they followed them for many years, and that sanctuary mixed the negative and the positive cats, and they never had any transmission. In the end, they were only following 4 cats to see if those cats became infected. So the study, does have some weaknesses in the terms of how many cats were really available to follow long-term. But I think this is all of our anecdotal experience as well. A lot of us have experience with having a positive cat in a household and not seeing it spread to the other cats. There also is a series of related papers that showed some other very important management outcomes. One is that cats with both FeLV or FeLV are likely to live longer and be healthier if they are in a home environment with none or few other cats. So living with 0 to 2 cats in a home environment was much better for FeLV and FIV positive cats than living in a sanctuary where they died sooner. And that shouldn't be a surprise to anybody. It is stressful for cats, even if we don't see it. It is stressful for cats to live in large groups, especially if they're confined. That hopefully what we'll hear throughout the day today is a lot of evidence and enthusiasm about adopting all of these cats into good homes where they can live stress-free lives rather than keeping them in shelters or in other institutional settings. All right, so where does all of this new knowledge land us in terms of recommendations for screening in shelters and rescue groups and TNR programs and others? A big shift. So the 2020 guidelines that you have a copy of and you really should be very familiar with address an emerging trend in which screening for FeLV and FIV is increasingly shifting from animal shelters, where cats are adopted, to veterinary clinics where animals will receive their lifetime comprehensive care. This is a huge culture shift from the past. In the past, shelters have assumed responsibility and were expected to screen all cats at intake and certainly before adoption. And that required enormous investment of costs and time that we have been thinking about being invested in better ways to save more cats. There are no shelters that have enough resources to do everything they would like to do, so they have to make choices to make the resources that are going to have the biggest impact. And that has never been truer than today with COVID and shelters retooling on the fly what they have to do and doing a lot of virtual work to keep cats and dogs moving through their system quickly. So the big trend to be familiar with is the option not to screen all cats in your organization if that makes sense for you. There's nothing wrong with doing it if you have the resources and you're getting your other work done. But if testing is putting a strain in any way on your resources, you could consider reducing or eliminating testing. And really, we all went through that years ago with TNR. That was the first big population of cats that we pulled back on FeLV and FIV testing from, because we knew we could get better welfare and control of cat populations faster if we neutered more cats in TNR programs. We really needed to scale them up. And we knew that if we spayed and neutered more cats in TNR programs, we were going to control the spread of the viruses faster anyway. So it was really clear that was the right action to do. It's been less clear in shelters until now. So testing is still needed in shelters in some situations. We would still want to include testing in high-risk cats as part of their workup and their veterinary care. So if they're sick, testing can often tell us if we need to keep the retroviral infections in mind as we care for them, or if they have a history of exposure to a positive cat. This is most commonly in the scenario of an intervention in a hoarding case where there's a lot of cats and a high rate of FeLV and FIV. And so we may want to test those cats and then maybe even test them again after a waiting period. Also, we generally would test before putting cats in group housing to avoid having spread in the shelter. This mostly applies to FeLV. A lot of shelters are doing group housing and not having any problems with FIV, or they're not testing for FIV at all. Sometimes shelters will choose to test before a significant medical intervention, such as an amputation or treatment for pain leukopenia. Not necessarily that they wouldn't do the intervention, but it might inform kind of the level of supportive care to offer to that cat. And sometimes in legal cases. So if there's a cruelty case or a hoarding case, that bit of medical information and documentation might help the case. This also requires that we really upscale our communication with our adopters, our foster homes, and the local veterinary community. Springing this on everybody, if your shelter is going to start reducing testing, is a good recipe for conflict. So the adopters really need to understand that their cats have not been tested, and they need to go to the veterinarian before they allow that new cat to mingle with their existing cats. And you know, you can tell them that at the time of adoption, and they probably hear about 10% of what you tell them, and they probably comply with even less than that. So more than likely, no matter how much information you give them about how to introduce a cat to the household, they're going to go home and let it loose with their other cats. So we need to make sure they don't do that, and help them make an appointment to get their cat tested as soon as possible with a new cat exam. Assure that there's a very smooth handoff of care from the shelter to the veterinarian, so that that veterinarian is very familiar with what's already been done in the shelter and what is still needed. And if you're going to have change your testing policies, it's a really good idea to go out and meet with the local veterinarians first, so that they're on board with you and they're not suddenly shocked when people come in and angry that you've changed your protocol, because then they're going to tell the new adopter that you've done a bad job. So this is an example of one shelter that did change its policy. I'm not saying that there's a right way or a wrong way to do this, but this is where the Edmonton Humane Society landed. They had excellent handout that they gave to both their adopters and to the local veterinarians, and they spoke with the local veterinarians first, and so they had a very smooth transition. This is the letter, this part of the letter, and I've highlighted some important things where they've explained that they've recently changed their policy, and this is why. They've explained the prevalence that they were getting, and that they couldn't always interpret the routine testing, and that they were spending thousands of dollars on testing plus the staff time, and they often misunderstood the results anyway. So they decided they would still test high-risk cats, sick cats, cats going into group housing, but they were going to stop testing single-housed cats and cats less than 6 months of age. I do want to make an important note that the AAFP guidelines have a good table that lays all out our current recommendations for testing and vaccination of shelter cats. So you cannot transmit this virus on your hands or your clothes. So if you have cats in your organization that are housed individually in cages, those do not have to be tested right away, because they are not going to transmit it to other cats. So short-term group housed cats, we would recommend that they be tested, especially for FeLV. And then foster cats, we recommend if they are going to live in a house with other cats, because those foster cats, even if you tell them to keep them separate from their own cats, they're not going to. And then long-term housing, I recommend testing for both FeLV and FIV, because this can be a more stressful housing arrangement, and we don't want FeLV spreading within confined group of cats. So I actually recommend annual testing, especially for FeLV, of sanctuary situations, because we do see higher rates of chronic disease in sanctuaries. And then trap-neuter-return cats, we don't recommend testing them routinely. Of course, you might test a cat that is sick or something. And then FIV vaccinations not recommended for any of these shelter populations, not even available in North America since 2015, but it is available in Australia and Japan and some other countries. FeLV infection, or vaccination, it takes 2 doses of vaccine to work, and it doesn't work on 100% of cats. It's not as good as like our pan-flu vaccines and rabies vaccines. So we don't recommend it for all of our short-term cats. Potentially for foster cats if they're going to be in long-term housing before they're adopted. And then I do recommend FeLV vaccination again for those long-term and sanctuary cases, because they're a little higher risk for, admitting cats that might have had regressive infection that then turn into progressive infection and spread it within the sanctuaries. I certainly have heard of that from people who call. And so finally, we'll finish up with adoption is better. Really pushing here that the take-home lesson from today is get these cats into homes. Don't keep them in your system, and certainly don't euthanize them. So this is the FELV adoption program at Austin Pets Alive. Austin Pets Alive is a large no-kill shelter in Austin, Texas, and they were one of the first to develop adoption programs. And people would send them their cats from all over the country and even some other countries and from Puerto Rico. And so they collected cats from all over, housed them, and then adopted them out. And it has served as an incredible research population for us to learn more about natural infections. This is just a map of where the cats came from the adoption study that we did to show that they came from all over. But also notice that this is one adoption program, and they get a lot of calls from shelters all over saying, can we send you our cats? And really what we would be promoting now is each of these sending shelters develop their own adoption program, because that way everybody can save their own cats. We're not shipping cats all over, talk about stress, and we can save more cats that way, because obviously they can't all go to Austin, Texas. So we looked at 801 cats that have been referred to this FELV adoption program over 2 years, 2017, 2019. And of all of those cats, when they were retested in Austin, 19% could not be shown to be infected. So right away, we're looking at, either they had become regressive and we couldn't identify them, or that original test was in error. And looking at the quality of the testing that was done, I think a lot of those were erroneous tests. They were either bad test brands or the wrong test to choose. Of those cats that were referred to the adoption program, 79% of them were adopted. That's huge. These are cats that traditionally would have been euthanized in shelters in the old days. 17% of the cats ended up dying or getting euthanized, and there were still 4% of the cats waiting for adoption in the shelter. So this should give you a great confidence to develop an FELV adoption program. People want to adopt these cats, and with good education, they will. Austin Pets Alive also did an adopter satisfaction survey. So they said, now that you've adopted a cat, what was your experience living with it? And the vast majority were positive or very positive. And then they said, would you do it again, knowing what you know now? And again, the vast majority said, yes, I would do it again. This is great. So you're going to have universal positive experiences if you trust yourself to develop your FELV adoption program. People have been doing FIV for a long time, but it certainly applies to them. They're so much easier because they never get sick. So how do you roll out an FELV adoption program? A lot of times you've got your first kitten, it's super cute, and you're like, I can't euthanize her, let's try to adopt her. And that is the beginning of an adoption program for a shelter. And that's exactly what happened at Treehouse Humane Society in Chicago. Their previous policy was to euthanize positive cats, but then they had some kittens that came back from foster that tested positive, these 2 kittens. And they called and they said, what should we do? And we said, why don't you just try giving them an adoption program? And so they developed this excellent fact sheet that would go to the adopters and help train their staff and their local veterinarians. And it was so successful, and they promoted these cats so positively that now they have converted their cat cafe into an FELV cat cafe. So isn't this great that the best quality real estate in the entire shelter, which is the cat cafe, belongs to the cats with FELV. So you're really showcasing them in a positive way and making the adopter experience as good as possible. And it's been very successful. And then I'll wrap up with this final example of a cat cafe. This one is in Seattle, called the Nico Cat Cafe. And I would love to hear from anyone if they have visited this place. I've only seen it online. It looks amazing. They sell snacks and they have a wine bar, and you can go there and hang out with your friends and the FELV positive cats and adopt them. This is really taking cat adoption to the next level and turning it into a positive experience. Isn't this great? This is another view of that Nico Cat Cafe, and look at those little tables. I desperately need one. Little cat tables. So with that, I'll wrap up with this quote from Dr. Sheila Segerson from Maddie's Fund. She says, people are adopting these cats, loving them and not regretting it. And here is one of those adopters. So I think we may have time for some Q&A. I'll leave this slide up here about the Million Cat Challenge. That was our campaign to help shelters save 1 million cats in 5 years over North America. They did it in 4 years, and now we have extended the campaign, and the new theme is that every cat will have the outcome that she needs, and we're helping shelters do that. So if you are not a member of the Million Cat Challenge, please go online and join us, and we can share all kinds of resources with you.
Excellent. Thank you so much, Julie. That was fantastic. If you'd like to share your webcam, I have a couple of questions for you, and I'm sure they're going to come rolling in now that we've opened up for questions. We have 143 eager listeners here. So one of the questions, there was a question actually going back to the different types of tests, and someone was asking, is there any testing with Zoetis ViraCheck? Is that something you're familiar with?
Yeah, the ViraCheck is probably, they're talking about the plate test, and that is generally used in labs. It's a microtiter plate that you can test 90 cats at a time in little wells. And some high volume shelters actually will use that in their clinic, which is just fine. And it's a good test. And but it does take, I think, a little more skill to use than the individual tests. There's a reason you can go to the drugstore and get a pregnancy test and do it yourself, because those tests are kind of harder to mess up. But the well tests require some very special washing steps, and if you don't do those properly, you can get false positives. So that is a good test.
Okay, now there's a question of a person who has a whole litter of kittens. All 5 kittens are testing positive. Based on your recommendations of having feline leukemia positive cats in 1s and 2s, do you just recommend separating those litters, or do you recommend keeping them together?
Good question. So I may have been confusing, like in the raising up a litter, they're always going to be more or less stressed if they're together. And I think if you segregated them into little groups, that would be a change for them. And, you know, obviously being adopted singly is probably a big stressful event, and it's worth it because they get out to the other side, but we should minimize the number of changes shelter cats have to go through to minimize their stress. And that we now know that, like, every time you move a cat to a different cage, it increases the risk of it getting a URI. And every time you take it out of the cage, it increases the risk of getting a URI, because their stress is such a factor in cats. And we just know, like, imagine taking your own cat to a shelter, how miserable it would be. So I would say a kitten, if you've already identified that every kitten in the litter is positive, I would keep that litter together until they're adopted out. Now, I don't think I would force someone to adopt 5 kittens to keep them together, so that you probably will split them up at some point. Now, if they are a mixed litter, I would separate those, because it's possible some of them are not infected and you don't want them to get infected from their litter mates. And I think a question that comes up a lot that I don't have a great answer for is, what about the neonates that are still nursing and some are positive and some are negative? Do you split those up? And I think I'd like to hear from Monica Frienden later in the day about how they manage their neonates, because that becomes, there's pros and cons of splitting up the litter and bottle feeding babies. It's not straightforward.
Do you see any trends with regards to gender? Are males or females more likely to be feline leukemia positive?
There is a slight increased risk for males to be feline leukemia positive. It's not nearly as dramatic as it is with FIV, since FIV is only almost exclusively spread by biting and bite wounds. We see 80% of FIV infected cats are males. In FELV, it's more like 55 to 60%. And that probably does that extra, you know, more above 50% is probably related to the fighting behavior that they got. So what we see, if you test cats with an abscess, 20% will have a virus. Like, that's, to me, is astronomical. We did a study of 1,000 cats with cat bite wounds, and 20% had FELV or FIV, and sometimes both.
And lots of questions, and I'm going to tag something on the back of it, which Monica may also talk about a little bit too later on, but is, you know, is there a particular preference for an age for testing? And then also, I've heard that maybe it's better to delay surgery, like spay-neuter surgery for feline leukemia positive cats. Do you have an opinion in that direction?
Yeah, two great questions that I commonly get asked. So I think part of it is like, what's the best scientific answer to detect the virus? And then what's the best practical advice so we can run efficient shelters and rescue groups? So what I've done, when we had a rescue group that adopted out about 1,000 cats a year, and I used to just test all the kittens at 8 weeks of age when they came in for neutering, because that just was super practical. They were out in foster homes, they came in for their medical care at 8 weeks, and we tested them. I did get burned a few times though, where we found some positive cats. But we also tested all the neonates in our orphan kitten program, and our vet students raised a lot of orphan kittens. And so I tested them at, newborns or whatever. And there was a time when I didn't retest at 8 weeks, and we made some mistakes. We had kittens that tested negative as neonates, and then later in life were positive. And so we backed up to repeating our test at 8 weeks. So I still would recommend testing the neonates, but then repeating it at 8 weeks when you're doing your spay and neuter and putting them out into adoption. I'll tell you my worst story just to make you lose all confidence in the ability to know, which was I took in a litter, a mother cat and her 4 8-week-old kittens. We tested all of the cats individually. The kittens were all negative, and the mother had this like weak positive funky test that the positive control didn't work properly. And so I separated mom from the kittens, and I retested everybody every month for 4 more months. Kittens always were negative, and I used both a SNAP and a witness test. And the mom always had a funky test, couldn't tell. So we adopted the kittens individually at 6 months of age after 4 months of following. And then mom went to her own home as well. A year later, or 6 months later, now the cats are a year old. Someone calls, their cat is very positive on FeLV and is dying of anemia, which is an FeLV related disease. So I called the other 3 kittens back who were in separate homes and tested them, and they were all positive. And I couldn't get mom back to test her. So take home for that is I did rigorous testing, and I misinterpreted those kittens to be uninfected. And I truly believe they did not coincidentally all get infected in their separate homes after adoption. Like, they were adopted. I did the best I could, and I still missed some. So it's liberating, I think, to think about we can't get to perfect, so we don't need to keep trying. What was the second part of your question? It was important too.
Oh, yeah, a surgery. So I've heard that sometimes if you do surgery at 8 to 10 weeks of age on a feline leukemia positive kitten, that it can be a little bit rougher for them. And so there's some thought about waiting until they're a bit older.
Yeah, and that's something that Monica taught me. In their program, the biggest cause of death of cats in their FeLV program is FIP. And they had developed a sense that if they did the early neutering that we would recommend for most cats, that increased the risk that those FeLV positive cats would develop FIP. So they decided to wait until young adulthood to neuter their cats. And I'm sure Monica will talk about that in her talk, but it makes sense. Like, you could definitely rationalize why that would make sense. And if it's not the topic of this talk, I don't know if you've had a whole day on FIP, but if you haven't, I recommend it because there's a lot changing in that landscape. And we know that FIP can be triggered by things like neutering. So I could definitely see why that would be the case.
And I'd say that there are quite a few other questions out here. One's like a housekeeping one. Just, do you feel like the IDEX FeLV SNAP has the same high quality results as IDEX feline triple SNAP?
They should be exactly the same. So the only difference is that the triple SNAP has the heartworm test in it. With that said, we do occasionally get kind of a run, or when that triple first came out, we had some questions about the retrovirus tests, I think especially FeLV. And so we reported that, and we submitted samples, and they went back and they fixed those issues when it first came out. So I do have confidence now. So basically, whatever you can get at the best price, I think, is what you should be using. Also, a tip is if you are using a cheaper test, or you think you might need to move to a cheaper test, you can call your IDEXX distributor, and very often they will match the price of those cheaper tests, which is really good, because if you just get the shelter pricing, it's usually around like $11 to $14 a piece, and you can negotiate that down. And if you're doing a lot of cats, that's a significant amount of costs.
To get the PCR result with numeric value, what's the name of the test versus the PCR that just says positive versus negative?
So currently, only IDEXX Labs offers the quantitative test. It's possible other labs will see how great it is and will make their own. And on the slide that I showed, that showed the testing results for abortive, regressive, and progressive infections, you'll actually see the test code listed there. If you search like IDEXX FeLV panel, you will probably also find it. It's a panel that, well, that's for the panel. So the panel would include the quantitative PCR and the laboratory plate version of the antigen test. And so I like that little panel together. It gives you kind of a nice, complete testing result at the point of time. But you're going to be looking, whatever you're looking for, it will be quantitative PCR, not, and you know, to be honest, I don't even know if they offer non-quantitative anymore at IDEXX. I haven't looked.
Last question before we close out. What are your thoughts with regards to putting FeLV positive cats in with, with another cat that is negative? Do you know folks that do that? And do you know varying opinions in that realm?
Yeah, I think that's where we would still recommend not mixing those cats. If they're all adult cats, they are going to have reduced, well, they'll have some natural immunity, but I think that just based on experience, that level of natural immunity is overstated. There are many people who have more confidence in the lack of spread, and I definitely get calls from people who have either intentionally or accidentally mixed cats together and it has spread, and they're frantic, and now they're retesting their whole population and trying to sort them into groups. So for what we know now, I really highly recommend they don't get mixed. Now, I was an internal medicine specialist before I came into shelter medicine, and so I would see these clients that brought in their cats, and we would diagnose FeLV, and I would say you need to segregate them from your other cats, and compliance was probably like 0. So we do have anecdotal stories where we follow these cats over time and they have not spread it. So it's not like panleukopenia, which is going to like spread rapidly among cats, but there's definitely more risk than with FIV.
Julie, thank you so much for spending your morning with us today. We really appreciate it. And this is incredible information. The comments out there, they thank you. Everybody's just thrilled. So thanks.
Okay, well, I'm going to be having your conference streaming on my computer while I'm working, because I'm really eager to see what everybody else says.
Excellent. Great. Thank you.